Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
An infant with heart failure is receiving diuretic therapy, and the nurse is closely monitoring the intake and output. Which is the best method for the nurse to use to monitor the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The correct answer is 1. Weighing the diapers. The best method to monitor urine output in an infant on diuretic therapy is to weigh the diapers. The weight of dry diapers is subtracted from the weight of wet diapers to determine the amount of urine excreted. 1 gram is equivalent to 1 milliliter of urine. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the best method and places the infant at risk for infection. The nurse reviews the record of a child who was just seen by a healthcare provider. The HCP has documented a diagnosis of suspected aortic stenosis. Which specific sign-symptom of aortic stenosis should the nurse anticipate? 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The correct answer is 3. Exercise intolerance. The child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but it is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." Which should the nurse do? 1. Ask what the other pill looked like. 2. Explain the purpose of the medication. 3. Check the original medication prescription. 4. Encourage the patient to take the medication. The correct answer is 3. Check the original medication prescription. Option 3 is the safest intervention because it goes to the original source of the prescription. Option 2 ignores the patient's concern. Option 1 is unsafe because the patient is confused and the information obtained may be inaccurate. Option 4 ignores the patient's statement and is unsafe without first obtaining additional information. An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? 1. Slander. 2. Battery. 3. Assault. 4. Libel. The correct answer is 3. Assault. This scenario is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a falsely spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation. The nurse has reinforced home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement by the mother indicates the need for further teaching? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities during which the child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after this surgery. The correct answer is 2. I can apply lotion or powder to the incision if it is itchy. The mother should be instructed that lotions and powders should not be applied to the incision site because these items can affect the skin integrity and the healing process. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. Which is a recommended guideline for safe computerized charting? 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting. The nurse is told that a child with rheumatic fever will be arriving to the nursing unit for admission. Which question should the nurse ask the family to elicit information specific to the development of RF? 1. Has the child complained of back pain? 2. Has the child complained of headaches? 3. Has the child had any nausea or vomiting? 4. Did the child have a sore throat or a fever within the past 2 months? The correct answer is 4. Did the child have a sore throat or a fever within the past 2 months? Rheumatic fever characteristically presents 2 to 6 weeks after an untreated or partially treated Group A beta hemolytic streptococcal infection of the upper respiratory tract. Initially, the nurse determines if the child has had a sore throat or an unexplained fever within the past 2 months. Options 1, 2, and 3 are unrelated to RF. A faculty member of a nursing program is conducting an informational session for potential nursing students. Which information about licensure to practice nursing upon completion of a nursing program should the faculty member include in the session? 1. It is a responsibility of the American Nurses Association. 2. It is granted on graduation from a nursing program. 3. It is approved by the National League for Nursing. 4. It is required by law in each individual state. The correct answer is 4. It is required by law in each individual state. The American Nurses Association standards of clinical nursing practice do not address licensure. When a person graduates from a school of nursing, the individual receives a diploma that indicates completion of a course of study. The diploma is not a license to practice nursing. The National League for Nursing promotes nursing service and nursing education. It is not involved with licensure. The Nurse Practice Act in a state stipulates the requirements for licensure within the state. Acetyl salicylic acid is prescribed for a child with rheumatic fever. The nurse should question this prescription if the child had documented evidence of which condition? 1. Arthralgia. 2. Joint pain. 3. Facial edema. 4. A viral infection. The correct answer is 4. A viral infection. Anti-inflammatory agents, including aspirin, may be prescribed by the healthcare provider for the child with RF. Aspirin should not be given to a child who has chickenpox or other viral infections, such as influenza, because of the risk of Reyes syndrome. Options 1 and 2 are clinical manifestations of RF. Facial edema may be associated with the development of a cardiac complication. A nurse witnesses an accident and assists the victim who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? 1. Seek consent from the injured party before rendering assistance. 2. Implement every critical care intervention necessary to sustain life. 3. Stay on the scene until another qualified person takes over responsibility. 4. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is 3. Stay on the scene until another qualified person takes over responsibility. When a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice. The nurse assists with admitting a child with a diagnosis of acute stage Kawasaki disease. When obtaining the child's medical history, which manifestation is likely to be noted? 1. Cracked lips. 2. A normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The correct answer is 3. Conjunctival hyperemia. During the acute stage of Kawasaki disease, the child presents with fever, conjunctival hyperemia, a red throat, swollen hands, a rash, and enlargement of the cervical lymph nodes. During the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. During the convalescent stage, the child appears normal, but signs of inflammation may be present. A primary healthcare provider orders out of bed to a chair as the activity level for a patient. How is the nurse functioning when moving this patient out of bed to a chair? 1. Interdependently. 2. Collaboratively. 3. Independently. 4. Dependently. The correct answer is 4. Dependently. Determining the extent of activity desirable for a patient is within the primary healthcare provider's, not a nurse's, scope of practice. Following activity orders is a dependent function of the nurse. The nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of heart failure. The nurse should observe for which early sign of heart failure? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The correct answer is 3. Tachycardia. The early signs of rheumatic fever include tachycardia, tachypnea, profuse scalp sweating, fatigue, irritability, sudden weight gain, and respiratory distress. A cough may occur with HF as a result of mucosal swelling and irritation, but it is not an early sign. Pallor may be noted in the infant with heart failure, but it is also not an early sign. Which element of ethical practice is associated with fair policies and procedures guiding allocation of organs for transplantation? 1. Justice. 2. Fidelity. 3. Veracity. 4. Non-maleficence. The correct answer is 1. Justice. Justice refers to fairness and that all patients should be treated equally, impartially, and without prejudice regardless of individual factors. Fidelity refers to making only promises or commitments that can be kept. Veracity refers to being truthful, which is essential to a trusting nurse-patient relationship. Non-maleficence refers to preventing harm, avoiding actions that can cause harm, or removing a patient from harm. The nurse monitors the daily weight of an infant with heart failure. Which finding alerts the nurse to suspect fluid accumulation and thus the need to notify the charge nurse? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. The correct answer is 4. A weight gain of 1 pound in 1 day. A weight gain of 0.5 kilogram or 1 pound in 1 day is a result of the accumulation of fluid. The nurse should monitor the urine output, monitor for evidence of facial or peripheral edema, check the lung sounds, and report the weight gain. Tachypnea and an increased blood pressure would occur with fluid accumulation. Diaphoresis is a sign of HF, but it is not specific to fluid accumulation, and it usually occurs with exertional activities. A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? 1. Code of Ethics. 2. Informed Consent. 3. Nurse Practice Act. 4. Constitution of the United States. The correct answer is 2. Informed Consent. Informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. The nurse provides home care instructions to the parents of a child with heart failure regarding the procedure for the administration of digoxin. Which statement by a parent indicates the need for further teaching? 1. I will not mix the medication with food. 2. If more than 1 dose is missed, I will call the healthcare provider. 3. I will take my child's pulse before administering the medication. 4. If my child vomits after medication administration, I will repeat the dose. The correct answer is 4. If my child vomits after medication administration, I will repeat the dose. The parents need to be instructed that if the child vomits after the digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. Additionally, the parents should be instructed that if a dose is missed and it is not noticed until 4 hours later, the dose should not be administered. A nurse initiates a visit from a member of the clergy for a patient. How is the nurse functioning when initiating this visit? 1. Interdependently. 2. Independently. 3. Dependently. 4. Collegially. The correct answer is 2. Independently. A nurse does not need a primary healthcare provider's order to make a referral to a member of the clergy. An interdependent intervention requires a primary healthcare provider's order associated with a parameter. When a nurse initiates a referral to a member of the clergy, the nurse is working independently. A nurse can make a referral to a member of the clergy. This action is within the scope of nursing practice. The nurse can make a referral to a member of the clergy without collaborating with another professional healthcare team member. A healthcare provider has prescribed oxygen as needed for a 10-month-old infant with heart failure. In which situation should the nurse administer the oxygen to the child? 1. When the child is sleeping. 2. When changing the child's diapers. 3. When the mother is holding the child. 4. When drawing blood for electrolyte levels. The correct answer is 4. When drawing blood for electrolyte levels. Oxygen administration may be prescribed for the infant with HF for stressful periods, especially during bouts of crying or invasive procedures. Drawing blood is an invasive procedure that would likely cause the child to cry. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? 1. To strengthen the defense. 2. To support the prosecution. 3. To present standards of nursing care as they apply to the facts in the case. 4. To make judgments associated with laws governing the practice of nursing. The correct answer is 3. To present standards of nursing care as they apply to the facts in the case. The American Nurses Association Standards of Clinical Nursing Practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence. The nurse is preparing to administer digoxin to an infant with heart failure. Before administering the medication, the nurse double-checks the dose, counts the apical heart rate for 1 full minute, and obtains a rate of 88 beats per minute. Based on this finding, which is the appropriate nursing action? 1. Withhold the medication. 2. Administer the medication. 3. Double-check the apical heart rate and administer the medication. 4. Check the blood pressure and respiration and administer the medication. The correct answer is 1. Withhold the medication. Digoxin is effective within a narrow therapeutic range. Safety in dosing is achieved by double-checking the dose and counting the apical heart rate for 1 full minute. If the heart rate is less than 100 beats per minute in an infant, the nurse should withhold the dose and notify the healthcare provider. The remaining options are incorrect actions. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? 1. State Boards of Nursing. 2. American Nurses Association. 3. Sigma Theta Tau International. 4. Constituent Leagues of the National League for Nursing. The correct answer is 1. State Boards of Nursing. The National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. The nurse is assigned to care for an infant with a diagnosis of tricuspid atresia. The nurse plans care, knowing which is true regarding this diagnosis. 1. A single vessel overrides both ventricles. 2. Frequent episodes of hypercyanotic spells occur. 3. There is no communication from the right atrium to the right ventricle. 4. There is no communication from the systemic and pulmonary circulations. The correct answer is 3. There is no communication from the right atrium to the right ventricle. In tricuspid atresia, there is no communication from the right atrium to the right ventricle. Option 1 describes truncus arteriosus. Option 4 describes transposition of the great arteries. In Option 2, frequent episodes of hypercyanotic spells occur in tetralogy of Fallot. When caring for a terminally ill patient, a family member says, "I need your help to hasten my mother's so that she is no longer suffering." Which should the nurse do, based on the position of the American Nurses Association in relation to assisted? 1. Not participate in active euthanasia. 2. Participate based on personal values and beliefs. 3. Participate when the patient is experiencing severe pain. 4. Not participate unless 2 primary healthcare providers are consulted and the patient has had counseling. The correct answer is 1. Not participate in active euthanasia. Nursing actions must comply with the law, and the law states that euthanasia is legally wrong. Euthanasia can lead to criminal charges of homicide or civil lawsuits for providing an unacceptable standard of care. A nurse's beliefs, values, or moral convictions should not be imposed on patients. Compassion and good intentions are not an acceptable basis for actions beyond the scope of nursing practice. Nurses, as well as other healthcare providers, cannot legally be involved with euthanasia. In some states in the United States, a primary healthcare provider can prescribe a medication that can be taken by a patient to cause death. The American Nurses Association, according to its Code for Nurses with Interpretive Statement, indicates that nurses should not participate in active euthanasia. Prostaglandin E1 is prescribed for a child with transposition of the great arteries. The mother of the child asks the nurse why the child needs the medication. The nurse correctly responds that which is the purpose of this medication. 1. Maintains an adequate hormone level. 2. Prevents hypercyanotic spells. 3. Maintains the position of the great arteries. 4. Provides adequate oxygen saturation and maintains cardiac output. The correct answer is 4. Provides adequate oxygen saturation and maintains cardiac output. A child with transposition of the great arteries may receive prostaglandin E1 temporarily to increase blood mixing if systemic and pulmonary mixing are inadequate to maintain adequate cardiac output. Options 1, 2, and 3 are incorrect. In addition, hypercyanotic spells occur in tetralogy of Fallot. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? 1. Document the patient's refusal to take the medication. 2. Discuss with a family member the need for the patient to take the medication. 3. Explain again to the patient the consequences of refusing to take the medication. 4. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is 1. Document the patient's refusal to take the medication. Withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time. The nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results. Which laboratory study should assist in confirming the diagnosis of rheumatic fever? 1. Immunoglobulin. 2. Red blood cell count. 3. Antistreptolysin O titer. 4. White blood cell count. The correct answer is 3. Antistreptolysin O titer. A diagnosis of rheumatic fever is confirmed by the presence of 2 major manifestations, or 1 major and 2 minor manifestations from the Jones criteria. In addition, Evidence of a recent streptococcal infection is confirmed by a positive anti-streptolysin, O titer, streptozyme, or an anti-DNase B assay. Options 1, 2, and 4 will not assist in confirming the diagnosis of rheumatic fever. When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? 1. Inform the supervisor. 2. Give the drug as prescribed. 3. Give the average dose of the medication. 4. Discuss the prescription with the primary healthcare provider. The correct answer is 4. Discuss the prescription with the primary healthcare provider. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice. The nurse is caring for a child with a diagnosis of Kawasaki disease. The mother of the child asks the nurse about the disorder. Which statement most accurately describes Kawasaki disease? 1. It is an acquired cell-mediated immunodeficiency disorder. 2. It is a chronic multisystem autoimmune disease characterized by the inflammation of connective tissue. 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. 4. It is an inflammatory autoimmune disease that affects the connective tissue of the heart, joints, and subcutaneous tissues. The correct answer is 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. Kawasaki disease, also called mucocutaneous lymph node syndrome, is a febrile generalized vasculitis of unknown etiology. Option 1 describes human immunodeficiency virus infection. Option 2 describes systemic lupus erythematosus. Option 4 describes rheumatic fever. A nurse administers an incorrect dose of medication to a patient. Which is the primary purpose of documenting this event in an incident report? 1. Record the event for future litigation. 2. Provide a basis for designing new policies. 3. Prevent similar situations from happening again. 4. Ensure accountability for the cause of the accident. The correct answer is 3. Prevent similar situations from happening again. Risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.